A multilingual AI-powered chatbot is being used to monitor the health of migrant workers who are diagnosed with Covid-19. The idea came from two doctors from the National University Health System, Dr Jen Wei Ying and Dr Stephanie Koh, and was developed in collaboration with AI healthcare startup Bot MD.
The chatbot has been named SG-DOM-bot and it's available in 5 languages, including Chinese, Tamil, and Hindi. Patients in the 6 NUHS's managed dormitories can use the bot to record their health data like temperature and heart rate. NUHS's clinicians will receive an instant alert whenever there are abnormal vital signs reported.
We're now joined by Associate Consultant Dr Jen Wei Ying to share more on SG-DOM-bot. Doctor, how did the idea to develop SG-DOM-bot come about? And if you could briefly take us through as well how it works.
So initially, when everyone was diagnosed with COVID-19, they were being cared for in hospitals. And when the number of cases in the dormitories surged, it became necessary to isolate many of them within the dormitories in order to avoid overwhelming hospital resources. We could only provide on-site medical cover during office hours. So we wanted to quickly design, iterate, and deploy a clinical tool to help our doctors care for all of these patients on-site, off-site, sorry. We also had to rapidly take care of the healthcare needs of thousands of dormitory residents. When we first came up with the idea, our priority was to enable the safe healthcare provision to a population which is in desperate need of it. The first few times we tried to deploy a solution, it took a bit of iteration because we needed to choose something which was familiar to the residents. Yeah. After a bit of iteration, we relied on a monitoring platform that worked through WhatsApp because most of them use WhatsApp for regular communication with their families. Downloading a new app was a little bit difficult because they had to go to the App Store, and when you ask them to input app names, unfamiliarity with the English language made it difficult to find those applications. QR codes were also not easy to use because residents didn't instinctively know how to scan them or open them. And so when we got to WhatsApp, actually it was very familiar and very usable, and we were able to teach thousands of residents how to use it very quickly.
Well, that's great to hear. So, Dr. Jen, a two-part question for you. How many patients have started using the app so far? And how effective has it been in monitoring the health of the patients and helping to identify as well those who need medical attention?
So we've had about 1,000 users log their vital signs over 10,000 times, and there have been about 100 teleconsults as a result. I think the development and iteration process has allowed us to have an uptake rate of over 90%, which has enabled safe monitoring and accurate identification of the minority of residents at risk of deterioration. So I think very few went to hospital, less than 20, and the 100 teleconsults that were done also allowed on-site doctors to focus on residents who needed attention the most, while expanding the available manpower to help render care, because a lot of us were able to do it from our homes during the lockdown. It also reduced healthcare worker exposure time and conserved valuable protective equipment. And one of the really important things was that it enabled us to tap on volunteer translators who've really helped transform the care we're able to provide to the migrant workers. I've been in the dorms in the community isolation facilities myself, and the language barrier is really quite difficult. But when we've been teleconsult and looping in translators in a 3-way call, we've been able to really get a lot more detail from the workers and help them a lot better.
Doctor, could you share some anecdotal examples of cases that were alerted via the platform and successfully received prompt treatment as well?
So I'll give you 2 examples. The first was actually a resident who reported through the platform that he was having chest pain. Now, Steph and I were incredibly surprised when we got that alert on a weekend morning because the platform wasn't actually live in that dorm at the moment. So we did a check and we found out it was a real resident. And when the team went to his room, he was actually having a very, very fast heart rate and having ongoing chest pain. And he was then conveyed by emergency ambulance to the hospital. And I think this was a proof of concept for us because, you know, he hadn't been taught how to use the platform. He just found the link from one of his friends who was in a pilot group. And the second example is actually someone who actually just had a teleconsult done today. He had visited the medical post in the dorm 4 times in 3 days. He's a fairly educated guy. I mean, he does his father is a doctor, and he was actually very worried since being diagnosed with COVID and being conveyed to a community isolation facility. And it was very difficult for the on-site medical team to get to the bottom of his complaints because of the language barrier. But after having quite an in-depth discussion with one of our volunteer translators, she was able to get to the bottom of his concerns, and he mentioned he felt a lot better after speaking to her.
Dr. Jen, you mentioned previously that there are many benefits that this chatbot has given to teleconsulting, especially when it comes to overcoming the language barrier. So, are there plans to further develop SG Dormbot to fill in other gaps in telehealth monitoring?
Yeah, for sure. I mean, we hope that COVID is not going to be with us for very much longer. But we've actually planned to develop this solution to scale for different telehealth solutions in the long term. And our monitoring dashboard is actually currently being built on secure servers to plan for this. And we've got ideas for things like diabetes, as well as blood thinning medications, a host of different conditions that we could develop this for.
Well, thank you so much, Doctor, for taking some time to share with us more on this SG Dormbot. And that was Dr. Jen Wei Ying, who led the project to develop SG Dormbot, an AI-powered bot for telehealth monitoring of COVID-19 patients.